So the next model that we talk about in terms of therapy is the humanistic and existential model. And what's interesting about humanistic and existential models or client-centered models, however you want to think about it, is they broke away from psychoanalysis as well as behaviorism. And there was a strong push towards the recognition of free will. So if you go back to the previous videos on psychoanalysis and behaviorism, I said they were deterministic. That means there's no free will. Everything is predetermined. As it relates to psychoanalysis, things were predetermined by drives. As it relates to behaviorism, things were determined by environmental triggers. So the humanistic and existential model rejects that. And when we think about this model as a whole, really you can combine them. And the idea of existential philosophy, it's been around for quite some time, but it morphed into an approach to therapy. And then we have the humanistic model that comes out of it. But if we were to look at this, the focus is on trying to figure out what drives people. What is the purpose of existence? So everybody has some purpose in life, and it's trying to help people access their purpose in life. So the humanistic view focuses on people and views them as friendly, cooperative, and constructive. Now, this is a shift as well from psychoanalysis, which focused on neurosis and pathology. So the humanistic model, there is an understanding that people start out relatively normal, and our goal is to help them reach their potential. So you'll see the second bullet point is we focus on self-actualization or reaching one's potential. It's different because if you think about psychoanalysis, the goal is to help people who are struggling go to normal, right? So from neurotic to normal. Whereas the humanistic and existential model, the baseline is normal, and the goal is to be a fully functioning person or self-actualized. Now, as part of this model, the existential piece, we believe that people are responsible for their choices, their outcomes, and we empower people to own their own experience. So things in general, according to this model, don't just happen to people. People make choices that bring them closer to self-actualization or further away. And, you know, it's interesting because in this model, there was a gentleman by the name of Viktor Frankl. And Viktor Frankl was a Holocaust survivor who came up with this therapy model called logotherapy. And he said that we all have choice. And if there's someone where you might say, well, wait a minute, you're in a concentration camp. How do you have choice? You don't get to decide what you wear, how you're called, what you eat or how much you eat, where you go, you know, whether you're moved from a work camp to an extermination camp. You don't have free will. You don't have any choice. But Viktor Frankl said, but yes, you do. And his point was that we can find smaller choices that make us feel meaningful and purposeful. So a choice of, you don't have a choice when you get up. Well, you have a choice whether you get out of bed or not. Now, if you choose to get out of bed, you can live another day. If you don't, it's possible that there would be extermination, right? Another choice. You don't have a choice as to what you eat, but you do have a choice as to how much you eat. So if you're given a broth and a piece of bread. You have a choice whether to eat the whole piece of bread, eat none of the bread, share the bread with a weaker person in the camp, and so forth. These are little choices that we can make, even in some of the disempowered states that one could be in. So he put an emphasis on responsibility, and an emphasis on owning one's choices and empowering oneself to take responsibility for their outcomes. There's also an emphasis in the existentialist view on authenticity. And when we say authenticity, it's being real or genuine. And we'll talk more about that as we go, but there is a strong emphasis on being an authentic self, not what society wants for you or what your parents expect from you, but just being yourself and living a real, authentic life for oneself. So when we think of the therapeutic model, the person that I want you to know about is Carl Rogers. And Carl Rogers came up with client-centered or person-centered therapy. And he discovered very early that one of human beings' basic needs are for unconditional positive regard. And unconditional positive regard refers to the ability to accept a person for who they are as they are, with no strings attached, no conditions. And if a person is raised in an environment that they receive that unconditional love and non-judgmental experience, that leads to healthy development. But if a person doesn't receive unconditional regard, they develop this concept called conditions of worth. What does that mean? That means that if I perform in accordance with whatever conditions you put on me, I have value. I get your approval. But if I don't live in accordance with the expectations you put on me, then you shun me. Then you reject me. I don't get your approval. And one of the problems with conditions of worth is that it distorts your understanding of the world, and it really confuses you as to what you genuinely need, what you truly need, versus what people are telling you they want from you. Now, I'll give you a very simple example. I want you to imagine that you're sitting at a Little League baseball game, and there are two teams playing, and it's the ninth inning, which is the last inning, and it's the bottom of the ninth, which means that the home team is up, is batting, but the home team in my scenario is down 3 runs, right? Now, there are 4 bases, home plate, first, second, and third. The bases are loaded. That means there's a person on first, second, and third, and you're batting, or a child is batting, let's say. And there are 2 outs. And this scenario is crucial because there's a lot of pressure on this child. If the child hits a home run, their team wins the game. If they get a base hit, they keep the game going. If they get an out, the game is over and the team loses. And in my scenario, I want you to imagine the child swings at the first pitch and misses. The second pitch comes in, they freeze up and they watch it. That's strike 2. And then the third pitch comes in, they swing and they miss again. 3 strikes, the kid is out. Now the team has lost the game. There are two kinds of parents at that game. There's the parent who hops over the fence, grabs the kid by their jersey and says, "Why did you miss the ball? You caused the team to lose. I am so disappointed in you." Well, in that scenario, that parent is sending a message to that child that I only love you when you're a winner. I only love you when you succeed. And you have failed, so you're a disappointment to me. So notice how when we say conditions of worth, my value, the love I receive from you, everything is contingent upon some expectation you have from me. That's not good. What Carl Rogers said is that we need to move towards this unconditional positive regard or unconditional love or acceptance. He talks about this concept called radical acceptance, which is you accept the person as they are. Now, I said there are two parents, right? Another kind of parent might also hop the fence and grab the kid, but they're going to grab the kid in embrace. They're going to grab the kid, they're going to hold the kid, and they're going to say, "That's okay. I still love you. You did great. You tried your best. We don't win every game." The message to that child is, my parents' love for me is independent of my performance. And that's huge because for most people, we crave that acceptance. We crave to know that we're loved, at least by some people, without demands put on us. So in Rogerian therapy or client-centered therapy, he put an emphasis on three factors: genuineness, acceptance, and empathy. We talked about genuineness. Genuineness is another way of saying being authentic, being real. Now, who has a responsibility for being authentic or real in therapy? Everybody. The client and the therapist should be their authentic selves. Acceptance or unconditional positive regard. There is this love for a person, an acceptance of a person, no matter what they tell you in treatment. Now, that is a very high level to be able to love your clients independent of what they tell you, because not every client is going to tell you, "Oh yeah, I just have anxiety." Some people are going to say, "Oh, I'm cheating on my partner. Oh, I'm cheating on my taxes. Oh, I'm robbing people. I'm selling drugs," right? So not every action that your client is going to tell you, you're going to say, "Yeah, I approve of that." But acceptance isn't that I approve of your actions. It's I separate you from your actions. And I embrace you as a person with dignity, regardless of your failings. That's acceptance or unconditional positive regard. And his goal is radical acceptance. Just accept the person no matter what. Now, how do you do that? That is a very high level, as I said. Well, Rogers said one of the ways to do that is empathy. And empathy and sympathy are not the same thing. When we use the term empathy, that requires us to put ourselves in the other person's shoes and try and understand what it might be like to be that person. Because generally speaking, behavior is motivated by something. So let's take the person who is, I don't know, robbing people. I'm not saying that that is the best choice, but if we were to ask our client, "Well, gee, why are you doing that? What motivates you to rob people?" And if they told you, "Well, I'm without work, have no opportunities for work, and my family is starving. That is a hard position for them to be in, right? So, and truly, you can't imagine what that's like unless you've been there. But at least you'll have a better understanding. Okay, this person isn't just doing this in a haphazard way. You know, there's a reason why they're making these choices, and everybody, you know, makes choices based on some need or another need. So empathy is trying to get a better understanding of where the person is. When it comes to issues related to suicide, we have to have tremendous empathy, right? So if a person tells you that they have thoughts of ending their own life, you know, that's a hard position. But I'm going to tell you that you're going to be more successful with your clients if you try and understand what's driving that and try and sit beside them. And what's interesting about the word client-centered or person-centered is we put the focus on the client, not us. So the client is leading or directing the session. And we put an emphasis on their lived experience and how their lived experience shapes their feelings. So the more you can sit with a person suffering, the better things will go. And in the case of a person who has suicidal ideations, more often than not, if you can do this, you can take a person who is in a very dark space and help alleviate that just by being there with them and letting them know you're going to be with them along the whole process and they're not alone. Because people can feel alone. And Rogerian therapy, you try and make sure your clients know that you're in this with them. So it's almost like you're a team trying to solve a problem together. So the therapist is going to almost reparent the child or recondition the child, or if it's an adult, recondition the adult client. And that what happens is if someone comes into therapy and they have these conditions of worth and they discover that their therapist has radical acceptance, accepts them for who they are, that takes a lot of pressure off. It takes a lot of stress that, oh, I have to perform a certain way. No, you don't. Just be yourself, and that's okay. Now, we also engage in active or reflective listening. One of the more powerful techniques in therapy comes down to active listening. Because when we engage in therapy, it's easy to run with our perception of what our client is saying. So reflective listening or active listening requires you to echo back to the client, not word for word, but perhaps in a paraphrase, I'm hearing you say this. And you could do a direct reflection, or you can reflect back the meaning of what the person's saying. So if a person says, I'm really sad and I'm struggling, you know, you might say, I hear you. I hear that you're saying that you're struggling right now. Am I getting that right? So you do a checkout to make sure that you got it right. You might also say, I hear that you're a little overwhelmed. The person didn't say that they're overwhelmed, but that would be an interpretation. Did I get that right? And when you make your interpretation, if you get it wrong, you're inviting the client to say, no, that's not exactly what I mean. Let me explain what I actually mean. So the active listening and reflecting back what the person is saying is very important. Now, as you can see, the focus is on the person themselves. Now, your book suggests that there's little research support for this model. And I'm going to push back and say, I think your book overstates the case. And there is more support for client-centered work. And in fact, even a person who doesn't truly follow Rogerian therapy models, they still use some of the principles of empathy, acceptance, and reflective listening. So even if you don't want to use the model as a whole, there are aspects of the model that all people tend to use. Then there's Gestalt therapy or theory. So you might have heard of Gestalt in terms of sensation and perception. You might have heard the phrase, the whole is greater than the sum of its parts. You might have heard things like that. But there is a therapeutic model of Gestalt therapy. And this model was developed by Fritz Perls and his wife. And he suggested that there is an emphasis on self-recognition, self-awareness, accepting a person for accepting oneself, better yet, even though one is going through challenges. Now, there are some really cool strategies or techniques that come out of Gestalt theory and therapy. There's something called skillful frustration. Now, skillful frustration is a technique where a client may ask you to do something, and because it's therapeutic, you intentionally don't meet their expectations. So I'll give you an example. I was working with a client who was diagnosed with borderline personality disorder. And this person did not respect the time of their session. So hypothetically, let's say their session was 3 p.m. Well, they would have a session from 3 p.m. to 3:45. But the person would come at 2:30, 2:40. Now, this is 20, 30 minutes before our session and expect to be seen. Now, most of us have clients stacked back to back. Maybe we give ourselves a small break, whether it be 10 or 15 minutes between sessions to write our notes or to just eat a little bit or reorient to our next client. But this person in particular saw me come to the front desk and talk to one of my coworkers. And they came back, and I took them at 3 o'clock. And they came back and they said, well, I saw you were talking with your coworker. Why didn't you take me? You were available. And I said, well, we have a designated time. And that time is sacred for you. But outside of that time, I use it for other clients or other activities that I need to do. And he was not happy, and he continued to show up early. And then one of the things that I did, which was skillful frustration, was in a couple sessions, I intentionally let him know that I was available and I could have taken him, but I didn't. Now, you might say, well, that's mean. Why would you tell someone you're making them wait in the waiting room? Because I was working on the therapeutic goal of boundaries. And I was working on teaching him to respect his time, my time, and other people's time. Because it isn't just our session. This pressure for or demand for people to be available at all times was translated to other people in his life. And intentionally telling him, I'm not available to you at all times, was important. And he was upset, and we talked about it, but eventually he got it. Eventually he started showing up 2:55, maybe 5 minutes or 10 minutes before his appointment, and he got it. So there are times where you're going to use the technique of skillful frustration, and it's important. Another example is a person who might have engagement with the court. I've had clients who have been mandated for therapy due to substance abuse or gambling addictions. I've had clients who are mandated due to child abuse, neglect, and maltreatment. And one of the hardest things with doing therapy where there's a mandate from the court is that that person doesn't want to be there. And you have to build a rapport and you have to build trust. And a common request from forensic cases or clients is, hey, can you write me a letter for the judge? And one of the things that I say is, I can write you a letter, but I'll do so in 3 months or 6 months to report on your progress. A letter saying you just started doing therapy is not useful. So now that is still frustrating. The person wants the letter now, wants the instant gratification, but you're saying, no, you have to earn it, because I'm not going to sign my name and risk my license to say you're doing better than you really are. You have to earn it. So there are times where we will intentionally say no and disappoint our clients, but when it's therapeutically appropriate. Another very cool strategy that comes out of this model is the idea of role playing. And role playing helps people conceptualize how they're going to do something. So let's say a person, and I had this with one of my clients, was struggling to tell their parents that they were gay, right? And they wanted to come out as a gay male, and they were very afraid. And one of the things that we did was we role played. We said, okay, let's try and imagine I'm your parent. Just try it. Start talking. And then I would role play the very supportive parent, the confused parent, the rejecting parent, and so forth, so that by the time my client came out, they knew what they were going to say and they knew how to deal with potential reactions. Another example, I had a client who, how do I explain this? The client, the daughter of the client was not biologically theirs, because in the marriage, the mother engaged in infidelity. And through the divorce process, the court said, well, even though this is not biologically your child, you've been taking care of the child. So you have now become the parent figure, and you're responsible for the child. So the client was responsible for things like child support because he took care of the child, but there was also a gag order. And the gag order was, you cannot tell the child that biologically they're not your child until they're 21. So the court did that to protect the emotional well-being of the child. Well, guess what? It was a year or so ago. The child was in college and they came across 23andMe. And they did their genetic testing. And they discovered a 100% match for their father. But it did not list my client. It listed another gentleman, because that other gentleman also did 23andMe. And now at 19, my client's daughter discovered that my client was not the biological father. And he was freaking out. He's like, I don't know what to say. How am I going to approach this? and we role played discussing why he didn't tell her. And we role played his authentic love for her, independent of the biology. And we role played discussing, how he tended to her needs regardless. So in his mind, she will always be his child. And they sat for lunch, they talked about it, and it went really well. But I also role played her curiosity, which is, if you discover that you have a biological parent out there, which you don't know, there is the possibility to have curiosity. So I role played how how she might say, I still want to know who my biological father is. I'm going to reach out to him, and how he should respond. And these techniques in both cases resulted in a better outcome for my clients. So role playing is a powerful tool. Now, we also require our clients to use first person language, not second or third person. So you must use I language versus it language. And why would we ask our clients to use I language? Well, it's simple. We want you to take ownership and responsibility for your choices. So the I language, it's starting with your experience. You're owning your experience. So versus he never does this, she never does this. In couples therapy, reinforcing I language is incredibly important, because you're going to hear he, she, you, and not so much I. And so you have to reorient the responsibility of my experience is ... I feel ... I need ... And you can say something, and here's a phrase that I help my clients use in couples therapy. When you do blank, now blank would be a behavior. I feel blank. So that would be your emotion, because blank, the rationale behind it. So now, even though you're talking about the other person's behavior, you're still letting them know your experience, how their behavior affects you, and why. So it's still, the focus is on the I. Now, what about spirituality? When we look at the history of psychology, some of the earliest textbooks on psychology incorporated religion and spirituality. If you were to look at William James is responsible for early American psychology, but he wrote a book, Varieties of Religious Experience, right? And the emphasis was on the meaning that religion and spirituality has on one's life. But when behaviorism took hold, when psychoanalysis took hold, both of these models left little space for religion and spirituality. And so the idea of talking about religion and spirituality in therapy was a big no-no. And I will tell you that that has changed, right? So it seems to have shifted significantly, because religion is part of our identity. So it is a diversity factor, and researchers are now studying the role of religion and spirituality as a protective factor and also as a stress factor. So we want to understand the role of religion and spirituality on mental health, and we address it. Now, how much do you talk about religion and spirituality? Depends on how much your client wants to. Again, the focus of this model is still client-centered. I'm not going to talk about religion and spirituality to a person who's an atheist. That just doesn't make sense. But I will talk religion in therapy to a person who is an adherent of faith and is struggling with how the faith impacts their life. We have to talk about it, right? Because we're talking about the suffering, and religion as I said, religious coping is a powerful thing. It promotes more healthy outcomes, but the pressures, the rules of religion can also, increase anxiety. So when we talk about religious clients, sometimes people worry about not living up to their ideals. So that's religion and spirituality. Let's talk about existential theories in therapy. When we talk about existential theories, we're asking a person, what is your purpose of existence? Why are you here? And one of the beliefs of existential theory is that people struggle because they hide from the responsibilities of life, or they avoid living up to those responsibilities of life. And when that happens, they might feel that their life is meaningless. So the goal of therapy is to encourage the person to take more responsibility, own up to their obligations in life, and recognize their freedom of choice. Now, you'll notice we talked about Gestalt, we talked about existential models, we talked about humanistic models. All three are emphasizing choice and responsibility to a greater or lesser degree. So they're in all of these models, there is an emphasis on what you're doing and how your choices affect who you are. And a question that I like to ask that's related to getting a person to take some responsibility for their condition is as follows. What are some of the choices that you're making that might contribute to your suffering? Now, notice I'm asking the question with the assumption that we all make choices, and some of our choices are less helpful than others. So inviting that person to think about how we contribute to our own suffering is important. And that is not meant to scapegoat the person. That is not meant to blame a person for suffering that other people did to them. But what are we doing with the suffering we have, and how are we healing from it? So let's look at this model in terms of strengths and weaknesses. One of the core strengths is that it focuses on the uniqueness of the individual. It focuses on free will and freedom of choice. It tends to be growth-oriented or optimistic, right? When we talked about Rogers, we talked about self-actualization or being a fully functioning person. You might hear of Abraham Maslow, right? His hierarchy of needs. And at the top of the model is self-actualization. So the focus on being that full person, reaching your potential, and so forth. There is a strong emphasis on health as well. I said that historically, psychoanalysis focused on neurosis. What's wrong with the person and how do we make it right? Whereas the humanistic and existential model says, okay, what's right with a person? What are some of your core strengths and attributes? And how do we harness that so you can be the best person you could be? That's the strength. The weakness is that these models have a lot of theory behind them. So they tend to focus on the abstract. And because of that, it requires higher analytical thinking. And this is a commonality between the humanistic and existential model. You require insight similar to the psychoanalytic model. It requires a lot of insight. Now, these models have some influence on the field, but do not have the same influence as, I want to say, cognitive behavioral therapy. I will tell you, I use, you've heard me say, I use a bunch of these techniques, so I use it. Now, historically, in early humanistic and client-centered models, there was a criticism of the lack of research support. Well, along comes positive psychology in the 1990s and focuses on creativity and positivity and strengths. And we harness some of that research, and it demonstrates that there is value and validity to these models, because positive psychology has also been wrapped into these models as an approach to treat. Now, I'm going to stop there, and we'll continue next with some of the sociocultural factors.